A single session as well as long-term practice of yoga was showing improvements on certain standardized cognitive assessments. And so these cognitive assessments look at memory, attention, processing speed. But these findings align with what other researchers have found in the literature, where they consistently see differences in hippocampal volume, where they see greater volumes for those who are yoga practitioners.
I feel like exercise, given its accessibility compared to, say, psychotherapy and medication, is something that can be really useful in places like Sri Lanka, where access to antidepressants, access to trained therapists is not as rampant as, say, it is here in Australia or in the States where you are. And
One is, like you very rightly pointed out, it's the HPA axis, right? It's that harmonization of your body or stress regulation or emotional regulation of your body that happens as a part of yoga practice.
before we dive into today's episode of the Mental Wellbeing College, an important disclaimer. We do dive into the weeds of mental health, which means that at times we discuss sensitive topics like suicide, self-harm, and substance abuse. If hearing such discussion does bring up distress for you, please do seek the psychological and professional treatment that you need. The content covered in this episode is not intended as a substitute for professional mental health treatment. Hello everybody and welcome back to the show. Today we are joined by Dr. Neha Gothe to discuss all things yoga and cognition. Neha is an assistant professor at Northeastern University and she's published prolifically in the field of yoga and cognition, including leading the first randomized controlled trial of yoga on cognitive function in older adults. Neha also spends considerable time mentoring undergrad and graduate students at the Center for Brain and Cognitive Health at Northeastern University, and it's fair to say she is one of the foremost experts in this particular field of yoga and cognition. In today's episode, we dive into yoga's effects on executive functioning, memory, attention, and much, much more, whether yoga can change the brain, Neha's work on yoga in patients with cancer, how yoga can impact our ability to manage and regulate stress, and much more. If today's episode of the Mental Wellbeing College brings value to your life, we would be super grateful if you were to hit subscribe, follow, and or to share this podcast with someone you care about. Our mission here, as I actually discussed with Neha during the episode, is to continue to provide an evidence-based resource that is accessible to the people world over to improve their own mental well-being, particularly through lifestyle behaviors like exercise, nutrition, and, as we discussed today, physical activity practices like yoga. Thanks so much for tuning in, and now to today's episode with Dr. Neha Gothe on yoga and cognition. Alrighty, Dr. Neha Gothe, welcome to the Mental Wellbeing College.
Thank you, Indy. Glad to be here.
Yeah, it's fantastic to have you on as well, all the way from Boston. We're going to be talking all things yoga and cognition, and this is a really interesting, really unique, but important area of research. And given its uniqueness, I'm curious, how did you get into researching in particular about yoga and cognition?
Yeah, so as you might have guessed from my name, I'm originally from India. I was born and brought up in Mumbai, and yoga has been part of my life pretty much since as far as I can remember from elementary school. Like we had physical education classes in school where oftentimes it used to be yoga, and the teacher would have you do some yoga and, of course, play some basketball and throw hoops. But as far as I can remember, yoga was always part of our lifestyle and practice. I was also an athlete. I played tennis, and I was always interested in exercise and mindfulness and yoga. And as I moved through college, I did my major in psychology. So I got increasingly interested in exercise psychology and the psychology behind movement. And all of those things eventually came together in me pursuing higher education in exercise science, kinesiology, and trying to continue uncovering the science of yoga along the way. I think the cognition piece and the passion for studying cognition comes from my training in psychology and as a counseling psychologist. and the passion for movement and yoga comes from my upbringing as well as my experience as an athlete, having played tennis. So I get to continue doing work with both my passions.
Seems like the cross section, yeah, of many of your different interests and passions,
Exactly.
which is cool.
Yeah.
Yeah,
Yeah.
and it's an interesting point about yoga being done in schools. So it's my understanding that it's quite mainstream, or it's done in a lot of mainstream schools. Yoga is embedded even in the curriculum in some states in India.
It is, including the government of India, where they have a lot of initiatives for not just schools, but also even public colleges, universities, hospitals, clinics to kind of um, study scientifically the benefits of the practice because it has historic origins in East Asia and in India. So there is definitely more awareness, more practice of it on a day to day basis. Of course, because of its popularity in the West, we definitely have a good number of teacher training, yoga teacher training schools and institutes in India as well, because of which it has become quite well it's become popular, and as a result it has come to the light for research and science and to evaluate the benefits of the practice. So all in all, I think it's a win-win, whether it is where it originated or how it has come to being popularized and practiced and researched in the West.
Yeah, yeah. I'm curious as well to know about your motivations for wanting to research into yoga, given your background. So I'm at the start of my own PhD and research career, and looking at exercise into mental health. And part of the motivation for me is my background is Sri Lankan, and the reason I bring that up is because I feel like exercise, given its accessibility compared to say psychotherapy and medication, is something that can be really useful in places like Sri Lanka, where access to antidepressants, access to trained therapists is not as rapid or not as rampant as, say, it is here in Australia or in the States where you are. And therefore, something like exercise has real applicability in that context. Is that the same for yourself at all with yoga? Is there a hope to use it on a more widespread basis in places like India?
Yeah, yeah. I mean, I've been now in the United States for a long time, but I know for a fact that similar challenges exist in Sri Lanka and India. I mean, we are neighbors. um, we have a large population and not sufficient healthcare and mental health care resources. Also, a lot of stigma around mental health, and not everybody wanting to seek treatment and help. May it be seeing a psychiatrist or seeking antidepressants or otherwise. And so people often opt for therapies, alternative therapies such as yoga or mindfulness, because they are less stigmatized, and they're more part of a culture and culturally acceptable ways of practicing a lifestyle or a movement lifestyle. And so I agree. I think there is definitely potential for yoga in that space, and there are some studies, although a handful, and we don't have conclusive evidence that yoga is as good as an antidepressant or yoga is as good as an anxiolytic drug. But the research is moving in that direction where more rigorous trials are trying to examine how good is yoga when you compare it with these other forms of traditional pharmacotherapy type dosages for these mental health treatments. And that's also true for physical health too. There have been studies, or we are in the early phases, but there are studies building towards efficacy trials looking at yoga for diabetes management, yoga for hypertension. And so, can yoga be as potent of a practice as taking drugs for diabetes or hypertension? So I think we are still ways away from making conclusive statements or prescribing yoga instead of an antidepressant or hypertensive. But I think we are moving in that direction. And I think in the decades to come, we should have only more and more evidence for this therapy and this practice.
Yeah, yeah, it's really interesting with the prescribing side of things. We're seeing here in Australia, at least, a lot of the leading national bodies advocate for like a social prescribing movement by primary care physicians with exercise, with nutrition, with sleep, as opposed to more traditional mental health treatments, which makes me excited. Yeah, for the the landscape as the evidence continues to come out, and certainly keen to dive into some of that evidence. I know you've done or are doing some work comparing exercise, aerobic exercise, and yoga, looking at cognitive outcomes there. But before we get to, say, comparisons of exercise and physical activity types, let's start with just kind of broadly, what is some of the evidence for yoga in terms of cognition?
Yeah, so in the context of exercise literature, we often quantify benefits of exercise as acute or immediate benefits. So those would be what you would experience immediately after engaging in that form of activity or exercise. And then you can also measure and quantify long term benefits. So those would be what you would expect to experience after a prolonged engagement in the practice. So that could be a few weeks, a few months, or longer, but more regular practice of that form. And the literature, one of the early studies that I undertook when I was diving and getting more interested in yoga and cognition was, let's take a look at what exists in this space. Let's take a look at what we know so far. What have researchers done to quantify yoga effects on cognition? And we didn't come across very many studies. It was quite an understudied area. We conducted what we call a meta analysis, and that's a synthesis of all the evidence base and trying to quantify that effect if we see an effect, and whether that is a significant impact that you're seeing in terms of effect on cognition. So at that time, and this was, I think, in 2016 or 2015, I'm going to say, so close to 10 years ago, we had only 15 randomized trials and 7 studies that looked at an immediate effect of a yoga practice or a yoga session. So that's not a lot of evidence, and a lot of those studies were not the best quality studies either. So they had a smaller sample size. That's the number of participants that enroll in the project, and that can really impact your study results and statistics when you're evaluating the results. So the although there was a handful of studies and not the best of the evidence and the quality, we did see trends that a single session as well as long-term practice of yoga was showing improvements on certain standardized cognitive assessments. And so these cognitive assessments look at memory, attention, processing speed, how quickly are you able to respond to a certain question or a prompt. So these are really things that try to holistically characterize cognition overall. And across the board, we saw, again, for immediate as well as long term effects, we saw yoga was showing demonstrably significant effects across these studies. We evaluated these studies across the lifespan. So these were pretty much adults through older adults, so 18 and above. We did not synthesize studies under 18 because there weren't very many of them. So we weren't able to make a generalizable statement on what that results would show. And so we limited that review to looking at studies that were done with adults, so 18 and up, across the lifespan. And we did come across studies that were done around the world. So the research and science of yoga is popular not just in India, but it does span across the globe. And researchers are increasingly interested in the practice and what it entails and what benefits it can bring to that practitioner.
Hmm. And as I understand it, your meta-analysis was done in healthy adults as well. So this is not people
Right.
necessarily with cognitive impairments, but you're still seeing the positive cognitive benefits of yoga in people without such impairments.
Exactly. And that's something that's saying something, right? If you're seeing benefits and effects in healthy populations, imagine what potential it has to make a difference for somebody who is struggling or somebody who has some challenges with cognition. And these could be individuals who have cognitive impairments, could have subjective cognitive complaints, could be individuals who are kind of experiencing situational cognitive challenges, such as, if you've heard of the chemo brain, for example, or the brain fog that cancer patients experience. It's a very well known reported phenomena that cancer survivors often experience brain fog or chemo brain when they are undergoing treatment and chemotherapy and radiation. And it's not very well understood. We don't know exactly what causes this. Is it the stress of being diagnosed with this disease, or if it is the treatment and often toxic medications that are part of your chemotherapy regime that might might be having some sort of side effects. So it's a very understudied and not well understood phenomena. And some of our more recent work we have tried to do is with populations who experience those challenges with cognition and brain fog, and can yoga have some potential to impact that? Because clearly from our meta-analysis, we see that yoga practice can benefit the healthy. So it can certainly be more potent and beneficial for those who are struggling with cognitive complaints.
Yeah, so I think the work you're alluding to here is the Stay Fit trial, which you're leading.
Yeah,
Um,
yeah.
are there any results out for that? Because I've only seen like protocol studies, kind of just stating what the outlined, methodologies will
Yeah,
be. Have you
yeah.
seen
So that
results?
was we are in the process of publishing. So we currently have a paper under review with Frontiers in Cognition, which is one of the peer-reviewed journals, public access. It should be out in a few weeks. But we essentially looked at what yoga could do for cancer survivors who were on average about 8 years since their cancer diagnosis. So these are individuals who have been diagnosed a while ago, and whether yoga could bring some relief for them in terms of these cognitive complaints that they might experience. So it was a group of 78 cancer survivors. We had a third of them practice yoga, a third of them practice aerobic exercise, and a third of them do stretching and toning exercises over a period of 12 weeks. And they exercised 2 to 3 days a week for a total of about 150 minutes, which is the CDC guideline or the physical activity recommendations for health and well-being for adults, where engaging in 150 minutes of exercise is what is prescribed for health benefits. Um, and so, one part of our study was to first evaluate feasibility, whether this was something that was doable, was acceptable, was tolerable for these cancer survivors, and was the prescription something that they could keep up with for 150 minutes a week. And so, we published those findings a couple years ago, where we saw that across the board, across all the three different kinds of exercises, cancer survivors were comfortable engaging in up to 150 minutes of activity. And these were group exercise classes because we did this intervention in a group format. Um, and then the second piece of that project was to look at changes, if any, that we see on these cognitive complaints that these cancer survivors often report and experience. So those results are currently under review for publication. But we are seeing that all exercise groups seem to have impacted those cognitive complaints and in a positive way. But we see a slightly differential effect for yoga, which is more potent in certain things than for the other groups. So I can't share more details until the publication is released, but
Yeah,
hopefully it will be in a few weeks and I can share the link with all the listeners and the project.
yeah. Excellent. Yeah, no, I'm excited to see those results, particularly given you've kind of foreshadowed, so yeah, some potent results, particularly for yoga. So that'll be very interesting to see. So, I mean, based on what we've discussed so far, it seems like there is some high quality evidence, randomized controlled trials indicating that yoga is beneficial for cognitive outcomes and functions in people doing yoga. What about impacts on the brain morphology or brain structure? I know, for example, you did a meta analysis in 2019 looking at the impacts yoga might have there. Can yoga change the brain? If so, what does that kind of look like?
Yeah, yeah. So we did another review. Again, we wanted to know what's out there, if it has been studied in terms of what and how does the brain change in the context of yoga practice. So we did two studies. One was a study where we actually collected data ourselves, and this was when I was at Wayne State University in Michigan with a fellow colleague who is a neuroscientist. We recruited yoga experts, and we found about 13 experts from the community around the university And these were people who would practice yoga regularly. So these were individuals who owned a yoga studio, who were teaching yoga day in and day out for 4 or more hours a day. They had done yoga for about, on average, I think 6 to 8 years of practice. So these were long term practitioners who had been doing the practice daily for several years. And we compared them with those who had never done the practice before. So we recruited a group, a matched group, age matched, sex matched group. So 13 yoga experts and 13 individuals who had never done yoga, never done mindfulness, were just not into those types of practices, I guess. And what we had them both do, or both those groups do, is give us some assessments about their health and well being, physical activity levels. And we had them go through an MRI scan for an hour, where we looked at certain structures of the brain. And as a part of the MRI sequence, we built in what we call a functional MRI task, where we asked them to do a cognitive task in the magnet. So we could look at what is happening in their brain real time as we are asking them to do something cognitively challenging. And what we found at the end was the yoga experts group had a larger hippocampal volume, and that was their left hippocampus was larger than the control group. And when they were performing the cognitive task, they needed less resources to perform the task, less neural resources. So we saw less activation in their brain. So essentially, they were able to do the same amount of work with less effort as compared to the control groups. So that was quite interesting. Of course, it's a cross sectional study in scientific terms. So there could be a lot of other confounders that could be attributable to the results. We tried our best to match the groups in terms of their age and fitness and physical activity levels. But you never know what other situational factors could play into these results and findings. But these findings align with what other researchers have found in the literature, where they consistently see differences in hippocampal volume, where they see greater volumes for those who are yoga practitioners. We know that hippocampus is one of those brain structures that is first impacted with aging and shows atrophy with aging. It is the region of the brain that's impacted for Alzheimer's disease and related dementias. It's one of the key memory centers of the brain, and we see that yoga has potentially the capacity to impact, but perhaps or maintain cognitive function or improve cognitive function and memory. um, we in following up with that study, we as we were reading the other papers that have looked at imaging results or brain related structures among yoga practitioners or people who are enrolled in a yoga program and evaluating the brain structures over time, similar regions of interest come up. It is that hippocampal region. We see the amygdala. We see amygdala is the emotional regulation center of the brain, and yoga is a mindfulness practice that incorporates a lot of, I guess, emotional regulation or stress regulation and management type practice. And so it's not surprising that we see amygdala kind of being another region that's impacted by yoga practice positively. Um, we also found in our study that it was the frontal cortex or the dorsolateral prefrontal cortex, particularly, so the region right behind your forehead, which showed differential effects compared to the controls. So, and we know the frontal region of the brains are responsible for cognition, especially the higher order cognition functions, what we collectively call executive functioning, planning, creativity, solving, decision making, multitasking. So these advanced cognitive skills, they're often modulated by that prefrontal cortex region of your brain. And across the studies and the meta-analysis, we see that region implicated again and again with yoga practice. So collectively, kind of the story seems to be that yoga practice, whether it is a long-term practice or whether you look at cross-sectionally a group of yoga practitioners, similar regions of the brain, similar structures of the brain, similar networks in the brain seem to be implicated in scientific research. A lot of these studies, again, are not as high quality as we would want them to be. Different researchers use different types of cognitive tasks or assessments, so there is no particular standardization that happens across these measurements. So there are certainly some challenges that make drawing conclusions difficult. But one of our ongoing projects, which looks at a large scale yoga trial and its impact on cognition and brain, hopefully that will answer some more definitive questions in this regard. We have a comparison group built into that randomized trial where we are comparing yoga with aerobic exercise. And the literature on aerobic exercise is vast. We know a lot more about what aerobic exercise can do for your brain, for your cognitive health, for your physical health. Um, Walking, running have been extensively studied. But what we don't know is how yoga compares to them and whether yoga offers similar benefits or more benefits in comparison to aerobic activities. So, our ongoing study should help answer some of those questions, and we should have some results in the coming years.
Hello, everyone. A quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode. Yeah, it certainly is a compelling story from the evidence that is out there that yoga does seem to have all these effects, and there are all these cross-sectional findings about changes in the brain for people who do yoga consistently for a number of years. So certainly is compelling. And as someone who has never done a yoga session myself in his life, I'm curious as to what your thoughts are on what particularly it is about yoga and what is done in a yoga session on the mat, so to speak, that may lead to some of these outcomes. Because obviously yoga can mean so many different things, right? It's typically some sort of combination of physical postures with breathing and meditation, but very different forms and types of yoga. So, I'm wondering, is it the meditation practice that leads to being able to down-regulate the HPA axis, our kind of fight or flight system, the sympathetic nervous system, which we then apply to stressful situations, therefore leading to less of the neuroinflammation effects on the brain from chronic stress because we're able to regulate ourselves better? Or is it the actual physical postures and the high intensity nature of that leads to adaptations neurally? What are the particular practices within a yoga session that may lead to some of these outcomes? And I use that word may intentionally, given it's all hypothesized at this point in time.
Yeah, we don't know yet, and I think hopefully our trial should help answer some of those early questions. You're right in the context that when you go to a typical yoga class, it's usually a combination of physical postures, breathing, and some meditative or mindfulness exercise. They might be done in different proportions depending on certain styles of yoga. For example, if you go to a vinyasa or a flow class, it's heavily on postures and moving from one form to another. So it might almost feel like a workout. And then there are other forms of yoga where it's more restorative. It focuses on alignment and body alignment more so than moving from one movement to another or one posture to another. So, depending on the form that you practice, certainly you could experience differential effects immediately after or with long term practice. What we employ, and in all my research, we have tested is what we would more broadly call hatha yoga, which is, I would say, 60 to 70% physical movement, about 15% of breathing, and 15% of meditation or mindfulness practice built into it. Um, Some of the breathing occurs as you are moving, so the breathing and movement occurs synchronously. So the instructor might guide you to take a deep breath and raise your arms and exhale and bend down. So the breathing happens synchronously with the physical movement. But at the same time, there are some yogic breathing practices that are independent of movement. So, for example, they are often collectively called pranayamas, and that is focused yoga based breathing movements and practices. A few of them are like an ujjayi breath or a lion's breath. Or alternate nostril breathing, where you would use your finger, your thumb, and your point fingers to guide your airflow with one nostril at a time. So there are certain yoga specific breathing practices as well, which are again independent of the physical movement. So for these yoga breathing practices, you would be seated in a chair or on the floor, and you would be following the instructions for that specific breathing practice. Um, Holistically speaking, the true yoga practice is a combination of all these three things. It's a combination of the movement, the breathing, and the mindfulness. And so, if you are trying to test what yoga can do for your brain or for your health, you are essentially testing a combination of these three things and what that combination can do for your health and your brain. But there is definitely merit in trying to tease apart those things, especially because we know there is a rich mindfulness and meditation literature at this point where there is MBSR, the mindfulness based stress reduction program. There is different protocols and programs surrounding mindfulness and meditation. And those practices or those programs are solely focused on the meditation. They don't incorporate breathing or the physical movement practices. And we know those practices show improvements across the lifespan for physical as well as mental health outcomes. So there is definitely merit in trying to tease apart what is the active ingredient that is leading to these changes, that's part of the yoga practice. In the context of aerobic exercise, we often talk about cardiovascular fitness, right? We say if you engage in aerobic exercise at a prescribed intensity, that's going to lead to certain adaptations for your cardiovascular system. It's going to make oxygenation more efficient in your body, and that is what is going to lead you to have a healthier, active lifestyle or improve cognitive function, etc. And so there is definitely certain mechanistic explanations for how the physiological movement of the exercise leads to biological changes, which then leads to the experiences the practitioner might have. In the context of yoga, going back to what we know about the mechanisms, there haven't been, again, the body of literature is much smaller than what we know from aerobic exercise and other forms of exercise. But in one of the reviews that we published just, I think, a year or 2 years ago, there are two essential mechanisms that seem to occur or have seemed to be evaluated in most of the literature. One is, like you very rightly pointed out, it's the HPA axis, right? It's that harmonization of your body or stress regulation or emotional regulation of your body that happens as a part of yoga practice. And that homeostasis, or bringing your body back to homeostasis or harmony, is what seems to be one mechanism that helps improve your health, improve your focus, improve your attention, improve your cognitive function. um, the second piece that seems to come up in some of the work is that neurocognitive efficiency that I mentioned. So the project that I mentioned, where we evaluated yoga experts, and they showed that they were able to do the cognitive tasks with fewer resources. They didn't need as much energy, or didn't need to engage as many neurons in their brain to do the job, and that efficiency of the brain seems to be something that is highlighted across some of the studies. So we see that mostly in studies where researchers have incorporated neuroimaging, so they have actually looked at the brain structure or function in an MRI, or they have incorporated EEGs. So you would just put on an EEG cap and you can look at activation, temporal activation in certain areas of the brain, and make some inferences based on that. So by and large, these are the two ways or two mechanisms that seem to be surfacing in this literature. We don't have enough evidence and enough well-powered studies to point to any biomarkers, so something in the bloodstream perhaps that could be indicative. In some of my work in the past, we have looked at cortisol. So we just had participants give us a saliva swab, and we were able to look at cortisol in the saliva, and that correlated with cognition. So lower levels of cortisol implicated better cognitive performance after yoga practice. And that cortisol piece ties us back to that HPA axis, or that kind of emotional stress regulation mechanism idea. And there could be kind of more markers that or biomarkers that we could look at and explore in the bloodstream that could help us answer some of those questions down the road. But yeah, by and large, it seems to be that the HPA axis, the stress regulation, emotional regulation piece, and then the on a cognitive level or the neuroscience level, it is the efficiency of the brain that seems to be a potential mechanism that's driving cognitive function and performance.
Yeah, right. Really, really interesting. And again, a lot of different hypothesized mechanisms there. So I appreciate you giving a very concise and accurate kind of summary of where the literature is at. And I suppose what comes to mind is from a psychological standpoint as well, and having a look at like what happens in a yoga session that may translate to cognitive outcomes. I came across this study, small sample size by Willem Muir et al. 2014, where they had yoga practitioners place their arm in a cold water, very cold water kind of tub for a couple of minutes, and had controls who had minimal experience in yoga do the same, and found that yoga practitioners were able to tolerate pain essentially in that really cold water immersion for a lot longer. But what they found psychologically as well was that yoga practitioners were more likely to use acceptance, a kind of mindful tolerance of the pain, just observing their reactions rather than reacting or trying to distract themselves from the pain. Whereas people without experience in yoga were more trying to ignore the pain, distracted, and something that's quite I suppose, cognitively energy consuming to try and do. So, just from a psychological standpoint as well, I suppose that relates to some of the things that are taught in yoga in terms of the mindfulness practice.
True, true. I mean, a lot of yoga is also interoception. The
Yeah.
breathing piece and the meditation or mindfulness piece is definitely heavy on interoception. So it's awareness of your breath, your body. It is awareness of your body in space, right? When you're doing physical movements. So certainly interoception is emerging as a mechanism by which yoga could help improve psychological health or as well as improve pain and pain management. In fact, one of my graduate students currently, she is an occupational therapist. Her dissertation research is looking at a yoga program for chronic pain management and whether participants who experience chronic pain, whether a practice of yoga would help improve their pain management. And so I think that speaks to your point where there is something about learning to accept and learning to be aware and recognize that becomes part of the practice, or being in the moment that becomes part of the practice. And that can carry over to other experiences you have throughout the day, or you could apply that to other experiences that you have throughout the day. And I think we definitely need more evidence along those lines and kind of understanding and quantifying these experiences. Sometimes it has happened more than once now where we have tried to identify the best outcomes and the best questionnaires that we can use for a project, and eventually at the end of the study you have a couple of participants who come up and share something completely different, which is very meaningful, very impactful. But oh, I didn't have a measure to assess that. I didn't have a questionnaire to ask the question and document it. And I think interoception and awareness is one of those pieces where every once in a while we have participants who come and say to us, yeah, they have really started watching how much soda they drink throughout the day, and they are very mindful of drinking water instead of grabbing a sugary drink from the freezer. And so they're definitely making or translating what they're doing, just being mindful about the choices that they are making outside the mat, outside the yoga class. And that is, we've even had participants who have come up and said they have become better at taking their medications on time, which I know medication management can also be a challenge. A lot of my work is with middle-aged and older adults who have a number of chronic conditions, sometimes multiple comorbidities. And so it's interesting, like we never quantify or ask those questions up front, but every once in a while they come and tell us these experiences that they have noticed themselves, that they are changing their behavior. um, Other than thinking about yoga as a physical activity, they are applying that behavior and those practices to other areas of their lifestyle and their behavioral choices. And that's also a different avenue to explore. There is some literature on mindful eating as well, where there is an exploration of kind of yoga and mindfulness interventions and programs, and how those could help transform eating habits, and whether those could help with maybe weight management, obesity, or kind of weight related disorders, anorexia nervosa, and similar. So um, can yoga be a tool, a behavior, a lifestyle that can help impact other behaviors and other lifestyle aspects? So I think there is there is only more to study and more to research for people in this space, and for those who are listening on the podcast, if they're interested in pursuing yoga research. There are no limits, there are no boundaries. I think yoga can have impact like far beyond the mat, far beyond a yoga studio for somebody's lifestyle.
Yeah, no, it's certainly a fascinating area, and it makes me excited to see the results of the multiple studies that you're running at the moment once they're out. And I mentioned before that I haven't ever done a yoga session, but I think now, having spoken to yourself, and I had the pleasure of speaking to Vanika Chola about yoga for mental health more specifically as well. I think I'm compelled enough to sign up to my first yoga session. So
Great.
it's certainly had a positive impact. Yeah. Just finally, Neha, is there anything, I suppose, else that you wanted to impart upon listeners, upon students that we perhaps haven't covered today?
Not really. I mean, just as a piece of advice or caution for those who are new to yoga practice or are looking to start a yoga practice, I would definitely recommend kind of consulting your primary care or a physician, especially if you have any health conditions, or any injuries or any comorbidities that could potentially interfere with yoga movements or practice. And of course, when you seek out a yoga class or participation, look for accredited instructors or trained registered instructors who have the adequate expertise to teach yoga and lead a group of participants through yoga. I think those are important pieces to kind of be aware of for somebody who is new to this space. um, because there are a number of different yoga styles and schools and practices. Sometimes yoga is popularized as movements that are extreme, and you do headstands, and those are not for everybody. And so it's
Yeah.
important to recognize that kind of where you want to come in, and how you want to start a yoga practice. It's always a good idea to start at a beginner, kind of a novice level, and then identify what aspects of the practice you enjoy, and if you want to push yourself or challenge yourself to something difficult or more intermediate or advanced.
Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental wellbeing. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.